Hi, it's Dr. Adrian from Advanced Dental Artistry here in West Perth. When dental implants fail, well, I want to really discuss from a patient's point of view the different types of failures and also how to prevent dental implant failures. Well, dental implants have been around since the 1950s, and of course they're very common practice now to replace missing teeth. There are probably about 10 to 15 major brands of implants, and really there's up to 200 individual brands of implants that are available in the market. So you can imagine that even in the USA on an annual basis, there are about 500,000 implants placed. That's 500,000 implants every year. When you consider that from research papers, the success rates are around about 96 to maybe 98% of implants, even if we choose somewhere in the middle, say 3%, we're still going to be seeing around about 15,000 complications just in the USA alone when it comes to implants. There are three categories of failures, and from a basic point of view, we're looking at biomechanical failures, and this is when, say, the implant actually fails. Maybe there's a fracture of the screw, a fracture of the implant. There's also, of course, cosmetic changes that actually occur, and this is a cosmetic failure where when a patient actually looks at the implant or looks at the gum around the implant doesn't really look right. And the last thing is infectious changes, where there's a problem with either the gum or the bone, and this is what I would like to discuss today, is these infectious problems. Infectious problems with implants is what we call PeriImplant Disease, and this is very similar, I suppose, to periodontal disease when we look around natural teeth. There are two types of PeriImplant Disease. One's what we call primary problems, which usually happens before the implant is actually loaded, and this happens within the first 3 to 6 months. This is sometimes called rejection, or this is when the bone doesn't grow into the implant. At times this can be painful. It's usually painless actually, and we do see some swelling and redness of the gums, and it happens very early on. So this is just when the implant's been placed, it hasn't had a chance to heal, and usually the implant hasn't been loaded, so there's no crown or bridge on top of the implant, and that's what we call a primary failure. The second part is the secondary infection or secondary failure, and this is after loading. So this is usually 3 to 6 months after an implant has been placed, and now we're seeing problems. There's certain stages when we look at implant failure. Of course, there's a healthy implant where an implant's placed to replace a tooth and everything goes to plan. 3, 5, 10 years later, the implant still looks like a natural tooth. It functions and it appears as a normal tooth in the mouth, and this is what every dentist and patient of course wants. There's a condition called mucositis, which is actually an inflammation of the gum, and I suppose when we're looking at it from a layman's point of view, it's really just like gingivitis around a tooth. It's usually caused by bacteria, and there's inflammation of the gum. And this inflammation, of course, means that there could be some bleeding of the gum, there could be some bleeding and probing by the dentist, and we normally find that there's a lot of redness associated with the tissues. From here we have what we call PeriImplantitis, and again, from a layman's point of view, it's like gum disease around a natural tooth. We normally get pain, we sometimes get some swelling, some draining, there's always infection, and there's swelling and bleeding. And this is a problem because PeriImplantitis is really about bone loss around the tooth. If this progresses past a certain point, we then see implant failure. So what are the ways to actually prevent implant problems? Well, there's kind of two categories to this. There's the dentist side, and of course there's the patient side. When it comes to the dentist side, the design of the crown or the bridge is actually critical. Things like, is the bridge or whatever goes on top of the implant, is it cleansable? Do they have nice contact points between implant teeth so that food doesn't get caught or plaque doesn't get caught around it? Is the implant actually screw retained or cemented? Is there a possibility that cement may be around the implant? And what is the type of abutment, or is it a titanium, a zirconia? What type of abutment is on the crown? The second part when it comes to the dentist factors here is also the implant position. This is why it's very important to actually not only use the right brand of implant, but have a very experienced surgeon that's placing implants. If the position of the implant is actually wrong, maybe it's too deep, too shallow, it's too far to the front of the mouth, too far to the back of the mouth, or maybe we have the problem where the soft tissue is not quite right around the implant, what we will see is we will see failure. And the last thing that a dentist can control is, of course, the implant system. We look at whether it's an internal or external connection, is it a bone or tissue level, and what is the surface, what type of surface or titanium surface is on the implant itself. Again, very important that the clinician that's placing the implant is very experienced, the brand of implant is very important, and all of these factors will determine how long an implant will actually last. When it comes to patient factors, I suppose the most important thing is general health. Patients with cardiovascular problems, patients that of course smoke or have diabetes have a much higher risk of failure because of their general health. We also can see patients on antidepressant drugs also have a higher rate of failure. The other thing is that the mouth must be clean. We must actually see no periodontal or gum disease around adjacent teeth or anywhere in the mouth, and naturally we also can't see any sort of infections around teeth that are next to the implant. And the last thing is just generalized cleaning and maintenance. The patient must have excellent oral hygiene, especially if they've got implants in their mouth that are associated or next to natural teeth. All of these factors are very important when it comes to longevity of implants. There is going to be another video on prevention and treatment of failed implants. If you have any questions, please give us a ring at 1-800-SMILING. I look forward to one day seeing you in the practice.